94.3 WYBC, the rhythm of the city. Juan Castillo with you on the workforce. And of course, it's a 6 o'clock hour right now. I'm finishing up strong like I always do. And I have with me here in the studio, CEO of Hartford Healthcare, Jeff Flaks, with me to talk about something extremely important in our community. As you know, Black and Latino communities have had problems in terms of the mistrust about, the COVID vaccine. We have partnered with our Hartford Healthcare, and we've got an initiative right now that we're doing the Hartford Healthcare COVID-19 vaccine pledge along with WYBC. We've had quite a few people that have joined our pledge. I've, of course, pledged. And we have Jeff Flaks here, the CEO. How you doing, Jeff?
I'm great, Juan. I'm great. Thank you.
Wonderful, wonderful, wonderful. So tell me, I know there's been some difficulties in terms of trying to reach, minority communities because of the distrust, and also just opportunities to be able to get it. Talk to me about what Hartford Healthcare is doing about that.
You're absolutely right, Juan. Our job, I think, from a healthcare system perspective, is to educate, to inform, and to remove barriers. So we have to use whatever capabilities we have. We can't expect in every instance for people to come to our centers. We have to bring our care to where people are. So we're using mobile vaccine programs. We're using vans. We're using pop-up clinics. We're using this pledge that you described. We're partnering with churches, with homeless shelters. We're partnering with community groups. However, we can align with people who are trusted, who are embedded within our communities, where we can bring our expertise and our team into the community and deliver the vaccine. And it's making huge results. Juan, we've already done 400,000 plus vaccines at this point in Connecticut. And I'm really proud to say, Juan, that over 35% of our vaccines over the last month are going to those 50 zip codes that have been prioritized by the state of Connecticut, where there is greatest need and where there are most vulnerable people living.
Yeah, and talk to me about, of course, the science, right? There's no question that this thing is working, right? Tell me why is it working, and why are we now getting ready to basically open up the state? Talk to me.
Absolutely. So, Juan, first of all, this is a personal decision. And, I always urge people to speak with with whoever provides medical advice to them, physicians, yes, clinics they go to, and to get educated and to become more informed. And again, our job is to make information as readily available, make our people as accessible as they can be. But Juan, let me just give you a few data points to really reinforce where and how this is working. Today, if you look at our organization, we have 108 patients who are admitted across our hospitals across the state of Connecticut. And none of those people who are admitted patients today completed their full vaccine course. So it shows that the people who are in the hospitals today are largely, in almost nearly in every instance, not vaccinated. And if we look at our nursing homes, where there used to be significant numbers of people who were COVID positive, since we first vaccinated all the people within our nursing homes, there's almost no instances of a person today within a nursing home who has been vaccinated who is COVID positive. So we have some really good examples that show that it is working. And we're advocating for people to make that personal decision to protect themselves, protect their loved ones, the people who are important to them, and to protect their community.
Yeah, it's interesting because I spoke to one of your doctors, right? And it's interesting what he said to me was, and this was when I was trying to make the decision. And by the way, I have taken the pledge, number one, and number two, I've gotten my 2 doses. And I'm more comfortable. I'm more comfortable. Now, it doesn't mean that I'm taking my mask off. I do have some underlying conditions that I got to be careful about. And so, but in making that decision, I went through the same process that a lot of us do, right? And your doctor told me, well, Juan, I got to tell you, right? If you want to go anywhere and you want to feel comfortable, right? You gotta put that into the into the whole situation around you making this decision, right? And he was right, because even though I'm still taking precautions, right, I feel more comfortable. My whole family has been vaccinated, which means that when we get together now, we got a different kind of perspective in terms of how we feel about each other. Talk to me about that.
Juan, I'll tell you, from the earliest days when we were doing the people 75 years and older, I was in the vaccination centers, and you see people who hadn't come out of their house in many instances,
Yes.
couldn't hug or see their loved ones. They were living in solitary kind of conditions. To see them get vaccinated, it was like watching someone be liberated in many ways. I mean, you could see immediately their joy and their sense of pending relief. I experienced it not long ago, like same way you described. It was enormously impactful for me, that moment. uh, this is an incredible, Juan, our doctors often have described this accomplishment for our country, for the world. This
Yeah.
is analogous. It's similar to putting a man on the moon. When
Mm.
you think about this vaccine being created in 9 months with the level of effectiveness,
Yeah.
predictability at a 95% type level, is unbelievable. And it's an amazing accomplishment. And we're so fortunate because we can see, as more and more people get vaccinated, and if we can get to that herd immunity level, that 70 to 80% level, we're going to be able to see people even be more safely, operating within our communities. But to your point, even with the vaccine today, certainly within indoor conditions and so forth, and wearing the mask, proper social distancing, good hand hygiene, still critical to containing the virus while we're still working through getting the majority of our population with the opportunity to be vaccinated.
Yes, and early on, I think that information was needed, right? And not saying that it wasn't available, but it's more readily available today. Having you sit here and talk with me today, right? It's extremely important to get people to understand that. And let's face it, we've been talking about the fact that when you take the vaccine, your arm is going to be sore. You
Right.
might feel a little bit, under the weather, maybe the first 2 days or even after your second dose. You know, this is the kind of information that people need to have, right? Because there's a lot of people are being misled, and especially with social media and so forth and so on, right? But I think that one of the things that you mentioned earlier, and I love it, right? Because it's a soft sell, it's not a hard sell, right? You got to give
Right.
people, this is America, people got to have the ability to be able to do what's best for them and their families, right? And I really do appreciate that in the direction that you're coming from.
Juan, the way I view this, and I say it all the time, our job is to educate, to inform, and most importantly, to remove barriers. So this is a personal decision, and it's a decision that's an important one. It's one that people have to make as an individual. But we want to help them make that. We want to be their partner. We want to give them the information that makes them comfortable. We want to have the people who are helping guide them, people that they trust and respect and can relate to. I want to do whatever we possibly can to help the community and to help each individual. I say this, Juan, constantly. Right? We have to ensure that no community is left behind, but
Yes.
truthfully, we have to ensure no person is left behind. And
Mhm.
it's an individual decision, but we have to use whatever resources, capabilities we have so that people can make the best decision for them, for their family.
And at this point, it's not really even about appointments anymore, because I know you guys are extremely involved with a lot of clinics all over the state, and you're doing walk-ups now, right?
It's about removing any barriers, right? So we're doing walk-ups. I've talked to so many people, and I ask everyone I can if they've been vaccinated, and I want to help them as they make these decisions. And often people say, the appointment process, registering. There were
Yeah.
lots of different reasons that people said, well, maybe that's why I just haven't done it yet, but I will. Well, at some point we said, why? Can't we? Do we have enough vaccine supply now, and do we have enough opportunity, flexibility within the schedule that Juan, we could start to bring people in and say, what, just come, just show up, and we can do that today, and we're going to help. We're going to ensure nobody gets left behind, and if people just want to show up, we'll have people do the registration for them. We
Nice.
just have to remove barriers, right? That's what it comes down to. If someone wants to be vaccinated in our state, we have to make it so that they can be as easily as possible.
And just towards the future, also, I know you guys are also working on getting prepared, because that's what it's all about. For any kind of booster shots and things that are going to be happening in the future, correct?
We're ready. We're not
Yes.
going to stand this down. We understand that if that's necessary, and it's not clear, how that will play out, nobody knows. But to the extent that it happens, we're going to be fully prepared. Juan, I've said this throughout, this crisis. So often, all of us ask the question: when are we going to go back to normal? When are
Yeah.
we going to go back to normal? We all yearn to go back to normal in every part of our life, but Juan, not in healthcare. In healthcare, we're going to be better than normal. and we already are better than normal. And the
Yes.
examples I give are like if there were needs to be boosters. I mean, the partnerships we've created, the mechanisms. We gave 1,000 vaccines to people who are in home and unable to leave their house. Right?
Wow.
There's so much more care we can provide. From a mobile health perspective, we've delivered hundreds of thousands of vaccines through mobile health type capability. That's the type of thing where we don't have to expect people to come to our centers, come to our clinics. We're going to go to where they are, and we're going to do it through partnerships. So we're going to be better than normal, and there's so many lessons to be learned. We have to make sure that we take advantage of everything, so that when we come out of this and we are turning the corner, that healthcare is actually going to be better.
Well, listen, we also want to send out a big shout out to all of your staff, right? From the doctors to the nurses to everyone that has really been on the front of this war, because that's what this was, right? That's what it is. We're still fighting this war. And just from us, from the community, from me, from the radio station, thank your staff for all the work that they do. They're superheroes as far as I'm concerned.
Juan, I love what you just said, right? You can't say it clearly enough. You can't say it loudly enough.
Yes.
What I've seen, but from people working the front lines of healthcare today, not only in our health system across the country, certainly across Connecticut, heroic isn't even strong enough word to describe it. It's inspiring, the courage, the bravery, the commitment. We've always known in healthcare how important people who work on the front lines of healthcare are to us, but it's probably never been more visible, more broadly than now. And thank you for saying it. And I echo everything you said.
Absolutely. Jeff Flaks, thank you so much. I appreciate you coming on. We're going to continue to partner with you and just to make sure that, we get this done. Thank you so much. Have a great evening, and appreciate you.
Juan, I appreciate you. Thank you. Thank you for the opportunity. Thank you for everything you're doing, for taking the pledge, for leading in this moment, and for communicating and informing. We're grateful for everything you do. Thanks, Juan.
Absolutely. Thank you. Juan Castillo is the Workforce right here on 94.3 WYBC.